Hello there. I'm Kate Walsh. I'm here today with Dr. Cassandra Pierre, Associate Hospital Epidemiologist and Medical Director of Public Health Programs here at Boston Medical Center. So Cassandra, thanks so much for taking time to be with me today. So you're the Associate Hospital Epidemiologist, and we're in the midst of a pandemic. What's your job like?
It is chaotic, but fulfilling. I've never gotten to meet as many people in the hospital as I have now, and I've worked here for 10 years or so.
Wow, yeah.
So it is sobering, but I really feel that I'm living my calling, and also feeling like a bit of the jack of all trades. We get to have meetings with the supply chain, with strategy, with facilities, get to tour the hospital to figure out what sorts of places, for example, might work for a showering facility for our staff who might want to shower at the end of the day. But I also feel like our hierarchies have kind of been leveled. Yeah. I work with medical students, with residents, having a talk with the CEO. I think this is really a leveling time for us. We all have talents and we all have gifts, and I think we're all trying to work to the utmost of our capacity together.
And we all have a role to play.
Absolutely.
Yeah. It's really been exciting. And I've been in many meetings with you where I've been so impressed by your ability to take a pretty complicated problem like how to sterilize a mask and put it into words that everyone can understand, from the physicians in the room to the people who are delivering those masks to the floor. What is it that helps you think about this? Like, how do you, when you have to explain a pretty complicated concept, how do you go about telling people how they can basically keep themselves and their families safe?
Well, first I have to explain it to myself. So that already involves decomplexifying. Yeah. But I think really the point is we want to make sure that we are doing the most good, that we're protecting people based on what we know about this particular pathogen. And we also try to and want to, as much as possible, standardize our approach among healthcare workers. It doesn't look right, and we've been learning this as time has gone on. It doesn't look right for a physician to have one set of PPE and for our environmental service workers, for example, to have another. Right. So I think that's something that we've learned over time. And in thinking about those different healthcare groups, we need to make sure that we have one message that makes sense for everyone.
Right.
So that helps.
The front lines are broadly defined by anybody who needs this personal protective gear. You often find yourself in a position of not arguing, but gently suggesting somebody doesn't need a level of protection that they might want to have. How do you go about doing that?
One way that I use to make it apparent that people may not need the level of personal protective equipment that they think they may, or that fear is driving them to believe that they may, is talking about the critical shortages that we have, unfortunately, in our PPE supply chain, and talking about the different levels of patient care people render, and then going up to the highest risk person and saying, we want to make sure that we maintain this level of PPE for those who are directly in the line of danger.
What I've heard is you're responsible for keeping our healthcare workers safe, broadly defined, our patients safe, their family members safe by visitation policies, people who bring us food and supplies and equipment. What is sort of the unifying theme to that work?
I think that it is really about community. We belong to our community more so than many other hospitals in the area. We are the community that we serve. And so keeping our staff safe, as you've mentioned, keeps their families safe. Many of our employees are caregivers for those in that very vulnerable group that might experience the most severe consequences of COVID-19. And so it is of utmost importance to keep them healthy, to protect them, so that not only can they go home to their families safely and keep them healthy, but so that they can come back the next day and continue to care for our patients. And so, yes, it is about equity. It is about ensuring that we are taking care of ourselves, really, because we are our community.
That's just incredibly inspiring. I want to thank you for your time and appreciate everyone who tuned in today. Thank you.